Welcome to our show Health and Wellness Myths and Facts. The pandemic has put mental as well as physical health and wellness into sharp focus. Throughout the COVID-19 pandemic, several coronavirus variants have emerged as the virus SARS-CoV-19 continues to mutate and evolve. In November 2021, a variant of the SARS-CoV-19 coronavirus emerged and was named as Omicron by the World Health Organization. Even though we have a variant which causes a mild infection, it can affect the vulnerable and the unvaccinated population. Due to Omicron's high rate of transmission and danger to unvaccinated and unboosted people, hospitalizations could rise dramatically in the coming months. People with chronic diseases should be more careful about the management of their conditions during this phase. Chronic diseases are the major cause of death and disability worldwide. The total number of people dying from chronic diseases is double that of all infectious diseases. The two most common and leading causes of death are diabetes and heart disease. Altered lifestyle is a common risk factor in all major chronic diseases. With the pandemic, chronic diseases are on the rise. Social media use has increased in emerging and developing nations in recent years. People may get misguided due to medically incorrect and unverified content. Expert advice will help our viewers get the medically correct information and act accordingly. Let me introduce our guest to you for today. We have Dr. Rohit Kapoor, MD, FACC, USA, FISC, FICP Cardio, Diabetologist, Medical Director, Carewell Heart and Super Speciality Hospital, Amritsar. And we have Dr. Hamad Momin. He's MD Medicine, DNB Cardiology, Interventional Cardiologist, HJ Doshi Ghatkopar, Hindu Sabha Hospital, Mumbai, and Director Cardiology, Dhange, and Prime Hospital, Bhiwandi. Thank you all so much, doctors, for joining us today. Starting with you, Dr. Kapoor, in the midst of the surge in Omicron cases, one of the most frequently asked questions is how long should an infected patient stay in quarantine? If this infection is not severe, then is it okay for the person that he gets back to his or her routine as soon as he or she feels better?
Thank you very much for this question. But the thing is this, if the person is COVID positive and I say it's Omicron is there, and because we can judge Omicron by some gene patterns. And another thing is this, if the person is even asymptomatic, but he is COVID positive, but he cannot join any office or he has to be quarantined minimum for 7 days. That's very, very important. Because what we have seen with this Omicron, the transmissibility is very, very high. It's more than the last variant, which was the Delta variant, and initially it was the Alpha variant. But definitely 7 days quarantine is must if you are COVID positive. And secondly, even if you don't have any symptoms, very, very clear it should be. You are asymptomatic, you have to quarantine for 7 days. Now, if you have got symptoms, and the symptoms normally they recover in 3 to 4 days, because Omicron is a bit a milder variant, definitely, but I should not say it's a milder because people may not become careless about it. But 7 days quarantine is must for any patient who is RT-PCR is positive, even if you are asymptomatic. Thank you very much.
So point taken, 7-day quarantine is a must, whether you're symptomatic or asymptomatic, so that's very critical. Dr. Momin, in case physically vulnerable patients get infected with Omicron, which organs of the body will get severely affected? Can you tell us about that?
Very good question. Here I'd like to emphasize more upon the differences between the Omicron and the other variants. So the common symptoms related to Omicron are fever, sore throat, whereas loss of taste and loss of smell are rare as compared to the previous variants. And the rate of transmissibility is very high with this variant as compared to the previous one. So the physically vulnerable patients are those patients who are old age or patient with diabetes, heart condition, CKD or chronic bronchitis. So any organ of the body of these patients can get severely affected by the Omicron variant. Though it is termed by the South African Medical Association, but we have to be very careful, especially in the vulnerable patients. And the UK this Monday has reported its first death from the Omicron variant. So any organ of the body from lungs to heart to kidney can get affected.
So we do need to take care that as any organ can get affected. Dr. Kapoor, what are some of the symptoms of the Omicron variant? And if you can just tell us, are the symptoms same for the people who are diabetic?
Definitely, because this question is very important because we are having a lot of diabetic population in our country. You
Yes.
see, every 11th person is a diabetic. Prevalence is very high. And now, what are the symptom difference between the diabetic and the non-diabetic? Most of the symptoms like sore throat, the pain in the throat, you feel pricking sensation in the throat, some fever, some cough and cold. These are the very common symptoms in both the groups. But what happens in diabetes, because this COVID positive or the Omicron, it interferes with the glucose metabolism, not as much which the Delta variant do, but definitely the diabetes symptoms, they really become more increased. I mean, because people may have more high fever and more symptomatology concerning the throat, about the chest, about the cough. If your diabetes is not controlled, definitely you are going to have more symptoms. But otherwise, commonly we find in diabetic or the non-diabetic, the symptoms are almost nearly the same. So that's very important to understand. But diabetes, if it is not controlled, only then you find some extra symptoms related to gastroenterology, like some gastritis, some vomiting, some loose motions, and you are having feeling breathless, more if your diabetes is not controlled. Thank you.
Okay, so I mean, it's good you've explained us to that really well, but for a diabetic patient, they need to take extra precaution. Thank you for clarifying that. Coming on to the vaccination part of it, Dr. Momin, if you can tell us how effective are the vaccine booster doses at fighting against Omicron, and what is the ideal time gap between the second dose of the COVID-19 vaccine and the booster dose? Dr. Momin, if I can ask you a little bit about the vaccination, can you tell me how effective are the vaccine booster doses at fighting against this variant Omicron? And what is the ideal time gap between the second dose of the COVID-19 vaccine and the booster dose?
This is a very important question.
Yes.
It is very too early to speculate anything. Like Omicron has got 30 plus mutation in its spike protein, so it is very much capable of escaping the immune response of a body in the previous vaccinated person or the previously infected person. But we are expecting that booster dose will be effective in bringing us the better protection. Definitely, it will prevent the severe manifestation of disease and thereby decreasing the hospital stay and decreasing the guidelines for booster doses. The time gap between the second dose and the booster dose is going to be 9 months, and the beneficiaries will be mainly the doctors, healthcare workers, frontline workers, and any person with age 60 and more with comorbidities. They have to produce a medical same, and there won't be mismatch of a vaccination for the booster dose. Like if someone has got a Covishield in the previous 2 doses, the third dose is going to be Covishield, and same is going for the Covaxin. Thank you.
Okay, thank you for explaining that. Dr. Kapoor, if I can ask you, we were talking about diabetes, and diabetes is mostly asymptomatic. A person with diabetes can suddenly face a health emergency if his or her blood sugar rises too high or too low. What could be those emergencies, and how can one really prevent them? Because we hear this very often that, oh, the blood spiked, the sugar level spiked. So just tell us about that.
Now that's a very big question to answer. I mean, because there are the two ends of the diabetes. One is the hyperglycemia, when your glucose level is very high, and the another side when the glucose level is very low. Now, what will happen if your glucose level goes very high? You will feel much fatigued. You will pass much of the urine, much thirst, and you will have a polyphagia. Definitely, you can feel lazy. So much fatigability. These all signs, they are of uncontrolled diabetes and high blood sugar. Now, what happens in the low sugar, it depends upon what is your sugar level. Most of the people when we say the sugar level less than 70, it is called hypoglycemia. And now what happens in the hypoglycemia, which is more dangerous even than the hyperglycemia, because Sudden hypoglycemia or the lowering sugar can cause confusion, cold sweats. Patient can become confused. Patient can become dizzy. Patient can have a fall. Patient can have syncope even if it is less than 54. So these two ends of the diabetes, they are very important. Now the question is this: how to prevent it? The most important is this, that you have to be very strict to the medications. You cannot skip your medication if you want to control your diabetes. You have to check your blood sugar daily as far as by American Diabetes and Indian Association guidelines. Without checking, you cannot take the insulin. So once a day is must check for the diabetes to prevent uncontrolled diabetes. Now what happens if the sugar level is less than 70? You have to be careful. You have to keep some sugar things with you, and that is there. Because both these things, whether it's a high sugar, whether it's a low sugar, both can end up into the complications like heart attacks, and they can end up into like paralysis, stroke, or they can cause sudden blindness. So you see these complications, they arises in both ways, whether you are uncontrolled high sugar, whether you are uncontrolled low sugar. So you see these two ends of the diabetes, they are very, very important and pertinent to understand for a patient of a diabetes. And normally we educate a lot in our clinic. How to prevent to hypoglycemia and how to prevent the uncontrolled and glucose variability. That is very, very important. Thank you.
Okay, so like you've just said, it's important to prevent both hyper as well as in case somebody is high or low blood sugar. Just wanted to add on to that, like recently even WHO has said that the use of steroids shouldn't be done during Omicron. That also, in the second wave in Delta we saw it wasn't acting too well with the diabetic patients. So what are your thoughts on that?
Definitely, because I have treated more than 4,000 COVID patients in last 1 year. I know there's a new term we have developed. One is COVID hyperglycemia, one is COVID diabetes, and we have seen a lot of people of COVID, around 10 to 20% who were not diabetic, but after COVID they have developed diabetes.
Yes.
Now, what is the strategy? I'm going to publish that paper that over the 6 to 7 months when the COVID is over, and many of the patients, the 70 to 80%, they have recovered back to the normal glycemia before their sugar levels. They have come out of the diabetes. Now, definitely the cause of development of diabetes in COVID is an excess use of the steroids, medications, and the major reason was the stress. Stress hyperglycemia was considered one of the major risk factors in many Indian studies and Wuhan study which has confirmed it, that stress hyperglycemia was a major factor of development of diabetes and uncontrolled diabetes in the COVID patient. But definitely, because as I told you, 70% people, they recovered back in the next 6 to 8 months the moment they recovered from the COVID. So that is a separate term now we have coined.
Yes.
That is called COVID diabetes. Yeah, that is there. But nothing to worry. Keep up a diet control, lifestyle modifications, morning walk, exercises, keep your obesity control. You can recover back without even medication from this COVID diabetes. Thank you.
On that positive note, we'll be taking a short break. We'll be right back to discuss a lot more and understand a lot more about diabetes. Welcome back. Dr. Hamad, I would like to ask you here, we recently heard about a couple of cases where young and extremely fit people passed away due to a heart attack or a cardiac arrest. Is sudden cardiac arrest the same as a heart attack?
Yes, it's a very worrisome situation. Definitely the incidence of the sudden cardiac death is increasing day by day among the young people, and especially in this COVID scenario, which because of its prothrombotic manifestation, it has led to increase in the incidences and the prevalence of the sudden cardiac death in young people. So heart attack is a condition which is a term which is used mainly by the common people as a synonym for a myocardial infarction. Myocardial infarction is a condition from via coronary artery. So that is a heart attack, whereas uh, this thing, cardiac arrest is a condition in which there is cessation of the critical activity of a heart, or you can say the stoppage of the heart, and which eventually leads to death if not intervened immediately. So the mechanism leading to the cardiac arrest are ventricular fibrillation, then asystole, pulseless electrical activity. So any emergency conditions like myocardial infarction, pulmonary embolism, any condition can lead to cardiac arrest and eventually death. So heart attack and the cardiac arrest are totally different entities.
So thank you for explaining that really well, that what difference is between a cardiac arrest and a heart attack. Dr. Kapoor, when and how should screening for microalbuminuria be performed on patients with type 2 diabetes mellitus? And why is the screening important in person with diabetes? And how important is it?
Definitely, this is very, very important. In any diabetic, suppose I'm having more than 50,000 registered diabetics with me. Now the question arises, what is microalbuminuria?
Yeah.
It's a leakage of the proteins in the urine. And the amount in 24 hours, the urinary protein should be less than 150 milligram. Now what happens if it crosses 150 and it is less than 300, we say it is a microalbuminuria. If it crosses 300 milligram in 24 hours, we say this is a macroalbuminuria, like albumin is increasing more. Now, what's the importance of microalbuminuria in any diabetic person or any normal person, even non-diabetic? This microalbuminuria is considered in lot of researches and the studies one of the biggest risk factor for future kidney disease, for future cardiovascular disease, for future your retinal disease, and for future there is a blocking arteries and deposition of cholesterol even in the blood. You imagine how a simple test, microalbuminuria, can judge a person that how the person is a high risk patient or how he's at the risk. So any diabetic, now most of the organizations and diabetic associations and cardiology associations, they are recommending the level of evidence is 1A, that if any patient comes in your clinic, whether it's a diabetic, you must do microalbuminuria check in your clinic. All diabetologists, endocrinologists or cardiologists or GAPs, they should have a kit of checking microalbuminuria in the clinic. Because if the patient is positive about the microalbuminuria, at least you can judge that this patient is a high risk patient in the next 5 to 6 years of development of renal kidney disorder or this cardiovascular disorder or other diseases related to the vascular diseases.
Okay.
So microalbuminuria is the most important test in any diabetic coming to my clinic. And this is the most easy done screening test in any of the clinic. Anybody can do, patient can do themselves. And so that's a very, very important to check for microalbuminuria in the clinics. And that's the most important biomarker and the test in any of my diabetic person. Thank you very much.
Okay, I think you've explained that well, and why is it important to know that? We were talking about cardiac arrest and heart attacks. Dr. Hamad, if I can ask you, a sudden cardiac arrest usually causes death within minutes. So is it important to be able to read the warning signs, and what are the signs and symptoms of a sudden cardiac arrest?
Yeah, thank you. Basically, usually these are called as not exactly symptoms, but the prodromes, like the warning signs.
Yeah.
So it can be as early as from weeks to even to days, and it can occur abruptly also. So there will be a worsening of the cardiovascular status of the patient who's previously has any heart condition or new onset of signs or symptoms like chest pain, palpitation, which can be episodic or then breathlessness, episodes of transient loss of consciousness, fatigability, sweating. So these are the prodromes which can lead to onset of the terminal event, which can be like lightheadedness, sudden loss of consciousness, hypotension, arrhythmia, and finally leading to cardiac arrest with a stoppage of the circulation to the vital organ of a body and loss of consciousness.
So one should be aware and start looking out for these symptoms well in time. Dr. Kapoor, what are the common vascular and neuropathic complications of type 2 diabetes mellitus?
That's very important for every diabetic person to understand that if your diabetes is not controlled, I'm saying not controlled, then what it can lead to. The most common complication in diabetes, what I find, that is a diabetes neuropathy. It's a very, very common complication in which the patient says that he has some pricking sensation, he is feeling heaviness in the feet, in the legs, and sometimes he wants somebody should really do a massage on the legs, calf muscles. Somebody is having a lot of burning sensation. Somebody is crying with the pain in the feet and the legs. So much crying, even they sometimes weeps and they need some injectable. Somebody can become depressed due to diabetes neuropathy. But this all happens when the diabetes is not controlled. Diabetes neuropathy is a very, very common complication I find in my clinic of my 50,000 registered diabetics. And the most common symptom, earliest to detect, is when you feel some pinprick sensations or paresthesias in your feet, और इन when we say सुनपन of the पाँव कि मेरे पाँवों में सुनपन बहुत है, पाँव हैवी लग रहे हैं, ऐसे लग रहे हैं जैसे पाँवों के नीचे कोई कॉटन वूल है, ऐसे लगता है जैसे पाँवों के नीचे कोई stones हैं. So any of the sensation or any of the symptom if you have, this is a typically of the diabetes neuropathy. Now the question arises, if you have developed diabetes neuropathy, is it reversible? In early stages, diabetes neuropathy is definitely reversible if you keep a very strict control of your diabetes. That's the foremost important. And the foremost gold standard test of diabetes control is the glycosylated hemoglobin, which the value should be less than 7. Now, what are the other side of the thing in the question? Vascular complication. Diabetes is a very prodromic disease of causing vascular complications. Among vascular complications, it can affect the heart, it can affect brain, it can affect eyes, it can affect circulation of your lower limbs, upper limbs. And this all happens. Don't be fearful. If I'm saying these are complications, the people should not be fearful.
Yeah.
People should be warned about these complications. If this is not the way, if I'm saying that everybody say, oh, Dr. Kapoor, you have made me so fearful and afraid of the disease. No. If your diabetes is very well controlled, your A1C is very well controlled, I guarantee you, you are not going to be having any complications of the diabetes.
Yes.
The foremost important, keep up in your mind, do your good lifestyle modifications. If you are doing regular exercise, what amount of exercise? 150 minutes per week. That is only what you need a morning walk in a week.
Yeah,
if you
so
keep up your body weight, if keep up your BMI index properly, keep up your diet control, regular medications or insulin, whatever prescribed by us, and
Okay,
definitely you are not going to develop any such like complications. Thank you.
I think absolutely you've explained that really well. It's not about worrying about it, but it's about taking care, preventing it, knowing what can it happen. So thank you so much, Dr. Hamad and Dr. Kapoor, for explaining us these very important things about heart as well as diabetes. I think at this point it's important that we all take care of our health, whether it is managing diabetes well or taking care of our heart diseases, or most importantly at this point of Omicron, we protect ourselves. Please maintain all the COVID protocols, mask up well, wash your hands and maintain social distancing. Stay safe, and thanks so much for watching.